Hello, my name is Lou. I'm one of the Bristol Cancer Support Workers, and I'm here today to do the introduction for our First Steps presentation. I will be presenting to you the first few slides, and then I will hand over to my colleague, Kat. So what is First Steps? So First Steps is an information sharing session intended for all patients that are diagnosed with a cancer diagnosis, including patients that are undergoing surgery. You may all be at different stages of your treatment, but this is informative information that hopefully will bring you some comfort and reassurance. The aim is to provide you with the information on self-management and support following your diagnosis and throughout treatment. The information today is provided for patients as well as their families and carers. The sessions will be organised and delivered by our dedicated team of cancer support workers. So just to talk you through briefly the agenda for today, you will be receiving information on practical support, fatigue management, psychological support, including emotional impact of a cancer diagnosis, as well as information on eating well and keeping active, managing your life on treatment, personalised care and support interventions, and we'll also give you some information on the community services that are available. Once you've had a cancer diagnosis, you will find that you will have lots of different questions. This slide just shows an example of what some of those questions may be. And during these videos, this is how we're going to just try and give you a brief answer to some of those questions that you may have regarding the information that is available to you. So on this slide here, it's just some abbreviations that you may hear during talks with your cancer support worker or with your clinical team. It's just to give you a rough idea of what you might hear. And just so that you know what the terminology means. This slide introduces our cancer support worker teams. We have two cancer support worker teams. We have the Bristol team and we have our lovely Western team as well. So how can a cancer support worker help you? Well, first of all, it's important to tell you that we're not clinical, we're not medically trained. So we're here to give you support alongside your clinical nurse specialists and alongside your consultants, the clinical team, but we work very closely with the clinical teams. We do what is called a holistic needs assessment, which may also be phrased to you as a HNA. And this holistic needs assessment basically views you all as a whole. And we're here not to focus just on you as a cancer diagnosed person, but also it's just as to try and to incorporate the cover of your emotional and your practical needs as well. Support is available over the telephone, via email, and where need be, face-to-face as well. We also have the Cancer Information and Support Centres. We have one in Bristol and one in Weston. The Bristol one is located on the reception level 4 of the Bristol Haematology and Oncology Centre, where you'll be able to find information leaflets available on a range of subjects, including types of cancers, tests and treatments, and carer support. These information leaflets are available on request, and you can just speak to one of your cancer support workers or to your clinical nurse specialist teams, and we will provide those information leaflets for you. You'll also in the Bristol Information Centre be able to pick up thermometers, waterproof pit covers, and these are located by the reception desk. But again, if you just ask a member of your clinical team or your support worker, and we will be able to provide these for you. The contact details, as you can see, are on the screen. And next we have the Macmillan Support Centre in Weston. So it's based at Weston General Hospital. Both support centres are open from Monday to Friday, 9 until 4. And again, the Western Centre offers emotional and practical support, information, financial advice, and self-management workshops. And the Western Information Centre also has their Macmillan Citizens Advice person, Judy, who arrives at the centre on the days of Monday and Friday. So she can also offer some financial assistance for you. So every patient with a diagnosis or suspected cancer gets discussed at our weekly multidisciplinary team meeting, which is also known as MDT. During MDT, it is attended by a range of professionals, and these include people such as your clinical nurse specialist, your chemotherapy nurse, your consultant, dietitians, physiotherapists, and your clinical psychologists as well. So what to expect once you have received a diagnosis and you are on our clinical pathway. So this slide just shows you the clinical pathway, which is in green, and our support services to you, which is in the orange. And it just details to you the start. So you will have your clinical investigations and testing. Then you will be told your diagnosis, and at which point it's helpful to view these videos in order to get yourself some information and to have some of your questions answered. I'm now going to hand you over to my colleague, Kat.
Hiya, I'm Kat. I'm one of the Bristol support workers. So this slide is just going to show you the various locations that your treatment can take place. Your clinical team will be able to talk to you about which site that you are going to for your treatment, and we can provide you on any information that you have that you may need if you have any concerns about travelling between the various sites. We know that appointments can be quite daunting and quite overwhelming, but there are lots of ways that you can prepare and help to make the most of your appointments. For example, it can be helpful to write down any concerns that you have, especially if you're at home and you think of them. Just jot them down and bring them with you so that you don't have to try and remember everything when you get into your appointment. If you can, it can be really helpful to bring someone with you just to have a second pair of ears. Patients quite often say that when they get to an appointment, they struggle to take everything in. So it can be nice to have somebody there with you just to help retain that information. If you don't understand some of the information, please do ask the team to go through it again with you. They can go through it as many times as they need to, just so that you feel informed before you leave your appointment. And it is possible for you to have a copy of your clinic letter if you would like it. If you just let reception or your clinical team know when you attend, we can make sure that your letters are sent to you as well. So with this slide, hopefully you will already know if you're over 60, you're entitled to free prescriptions anyway. But if not, prescriptions are free of charge if you're receiving a cancer treatment. So we can get hold of an exemption certificate, which your CNS consultant or your GP can provide for you. The form does need to have that clinical signature on there. It lasts for 5 years, and then at that point it can be renewed as often as needed. So both the Bristol and Western Hospital are really well served with transport and hospital links. If you do need any further information, then do get in touch with us. But these are just a few examples of how you can get to either of the sites. Parking. Parking is quite a big issue that we help support patients with frequently. So if you're coming to BHOC, so the Bristol Haematology and Oncology Centre, you can purchase a weekly ticket, which is if you are attending for regular treatment. So you need to pay £3.40, which is for the first 2 hours from the machine, and then we can issue with a permit. You can see the oncology reception or the information centre, or just speak to one of your cancer support workers and we can help you with this. Unfortunately, the permit doesn't guarantee you a space, but it does mean that you have that slightly cheaper parking when you are with us. If you're able to go to Concord Health Centre, parking is free, which is a nice perk. If you go to South Bristol Community Hospital, again, there is some assistance for parking. You just need to speak to the main reception or the nursing staff when you're there. Parking is paid for again at Western, but if you're attending for the day unit, then speak to the day unit staff and they can help you with claiming the money back for that. So there's lots of different aspects that we find people are concerned about during their treatment and their diagnosis. We know that it can be quite daunting, but hopefully with the support from ourselves and your clinical team, we can hope that you feel nice and supported with those queries. These are just a few of examples of concerns that we talk about and support frequently. Again, talking to friends and family can be one of the hardest things that you might have to go through during your diagnosis. It's important to know that even if you don't feel like talking about your treatment and your diagnosis, people will often want to talk to you about it. And it's okay to be as open and honest as you feel you can be, but also that you don't have to talk about it if you don't want to. It can be helpful to have some stock phrases in mind so that you know if the conversation starts and you want to end that conversation, how you can go about talking about something else. It's okay to talk about it and accept the help if you want to, but we know that it can be really difficult. Your phone probably pings left, right and centre with messages, people checking in, making sure you're okay. And actually that can be too much for some people. There is some really helpful booklets that we have, especially around talking to children and young adults. So do speak to us if that's something that you would find helpful. Pets, I know this would be a really big one for me. We do recommend you can care for your pets as you normally would. One perk is to get somebody else to change the cat litter or pick up the dog poo. Should you get scratched or bitten, we recommend cleaning it immediately and then just monitor the area and just alert your clinical staff or your GP if you do become concerned. And it can also be important to plan who would look after your pet if you're in hospital. So if you were brought in as an inpatient or you're coming in for surgery, or even if you're just in for the day, it can be important and just be peace of mind for you to know who you've got on standby to look after your pets. So social activities and hobbies will help you focus on your life outside of hospital and treatment. It can become quite monotonous coming in and out frequently for your treatment. And it's important to make sure that you have time to do those things that make you feel good. Whether that's reading a book or having a Zoom meeting or hoovering, dancing around the house like I would. It's important to do those things that will give you that joy and make you feel good about yourself. However, we do know that fatigue is a really common side effect of treatment, so it's important to try and make sure that you do have energy for those things. It can be difficult to decide whether to continue working through treatment or whether to take a break. We recommend talking to your employer and your HR department if possible, if you feel able to do that throughout your treatment. It can be important to consider whether you can actually carry on working or whether there's some adaptations that can be made, whether you can lower hours, perhaps work from home or a different office that might be nearer to you. And finances can be tied in with this one. So patients do sometimes feel pressured to keep working because of finances, and I will talk about that in a second. It's also important to remember that the Equality Act and Discrimination Act does say that your employer does need to support you and offer reasonable adjustments. So with finances, again, we recommend looking at these early and just making sure that you feel in charge and in control of your finances. We do get referrals for financial support quite a lot, so we're more than happy to help you with this. We quite often apply for grants for patients. These are normally just small one-off payments that can be used towards costs caused by your cancer, for example, transport or clothing if you've lost a lot of weight. There is a criteria normally for these. Normally these are means tested, but this is something that we can go through with you on a one-to-one basis. And there are also benefits that could be available for you. We work really closely with a team of Macmillan advisors in Citizens Advice, both in Bristol and Westham. And they can go through benefit assessments with you. And if there is anything out there that you can claim for, they will help you with this. Again, lots of people have travel plans, holidays booked when they start treatment or plan to go away, would like to go away. And we do recommend just discussing any of those travel plans with your clinical team. Just let them know where you're going and your plans. Tips for travelling. So these are just some handy tips for you. So we recommend taking a copy of your last clinical letter. You can either take the paper copy or if it's easier to take a picture of on your phone, just so that you've got the up-to-date information should you need it. Pop your medication in your hand luggage if you're travelling on a flight or on a cruise, just so that you've got it should you need it. If you're taking controlled drugs, these are strong painkillers, you may need to have a cover letter from your doctor or your clinical team just to state why you need to take those with you. And if you are going somewhere where you need vaccinations, again, just speak to your clinical team for advice about this beforehand. And then finally, I'm just going to let you know about Penny Bron, which you may have heard of already. Penny Bron is the UK national charity that provides free holistic care to everyone living with cancer. This is before, during and after treatment. And they will help support anybody that's been affected by cancer. So this could be your supporters and your family as well. They offer a really good range of one-to-one and group services, such as doctor's support, counselling, dietetic advice, wellbeing support and exercise therapy. They do this, at the moment, they do face-to-face telephone and online support that's available. And they're a really good centre. We refer lots of patients and we have really good positive feedback about their services. And I'm just going to hand back to Lou just to close this presentation.
Thank you, Kat. So just to end this part of the presentation, just to let you know how you can get in touch with us all. So this is the slide with your Bristol contacts details on, telephone number to reach us, as well as an email address. And as I said, we are available Monday to Friday from 9 till 4. This slide has details of your Western support workers. Again, they are open and available from Monday to Friday, 9 till 4. And with their Macmillan Support Centre, there's no appointment necessary. You can just drop in and see them. And their telephone number is on the bottom of that slide. And finally, just a slide with some other sources of information that you might find useful. We recommend these particular sites here to gain any further information that you may need. But please do feel free to contact us at any time.